Professor Cortellini, welcome to the Social Media Corner. You just presented us with a lecture about long-term complications in periodontal regenerative surgery. My first question goes to the part of the recurrences. Were the recurrences more related to systemic factors like smoking, stress, or more to local anatomical or technical limitations?
Two major factors. One is the systemic, for sure, general condition of the patient, behavior.
Absolutely.
And but also quite an interesting relationship with the residual probing depths. So it's very clear that the cases in which we last with a greater probing depth after regeneration are the ones who are more prone to recurrences.
When you mention that there was no correlation between biomaterial type and root resorption, for example, this also include the fact of using membrane versus membrane-free approaches for this specific outcome?
Yes. We have been making all the different comparisons among all the different types of regenerative materials, and we couldn't find really any correlation.
Okay. In terms of the ideal maintenance, what does your ideal long-term maintenance protocol look like for patients with regenerated sites, both in frequency and in type of monitoring, for example, probing, CBCT, etc.?
Well, most of these patients stay in a 3-month recall system, at least for 1 year. Then many of them remain in a 3 months. Few that are extremely good go into a 4 or even a 6 month recall. That is, I believe, the maximum amount of time that you can elapse. The dental hygienists are meant to take all the clinical parameters, so bleeding, plaque, and especially check with probes in the area where we did surgery. So the follow-up is done through clinical parameters, and normally every second year we shot radiographs, periapical radiographs, to monitor the long-term development of the site.
Super important.
Yeah.
And about the patients, do you educate patients differently today regarding the potential late for complications?
Not really. The perio patients are educated all in a similar way.
Yes. And talking about more specifically, for example, the stress that you mentioned in your lecture, consider the link that exists between stress and the recurrence. Should stress management be integrated into regenerative care, and how exactly do you manage these kind of patients in your practice?
Actually, stress is one of the factors that are included in our flow charts.
Yes.
We don't apply periodontal regeneration to patients with an overburden. And at that point, we try to correlate with the medical component.
Yes, of course.
So what we do with these patients is to do counseling. We suggest to the patient to take care of the stress of the overburden. Absolutely. The same is for smoke.
Yeah.
The same is for diabetes. All the medical conditions have to be taken care of by medical doctors.
By the specialty.
And when under control, we start regeneration.
The procedures, okay. And one of the catchy phrases and sentences from your lecture was when you mentioned that the outcome is stable if you make it stable.
Yeah.
Coming now to the importance of the SPC, the supportive periodontal care, how critical and structured should be the SPC in maintaining long-term stability in these sites?
Yeah, my idea, again, I said in public, the outcomes of regeneration do not expire.
Yes.
It's not like food expiring after 1 year. The maintenance is key, and the maintenance is key and is done by two components: the patient at home, with the due teaching from our side, so we have a responsibility toward the patient, and our professional overlook. So within the SPC, all the patient is, of course, followed up, and the areas where we apply the regeneration with special care, because we started from very severe conditions and we aim at long-term maintenance. This is the secret.
Absolutely.
Yeah.
And now more on a question on the future perspectives. Do you see the role of artificial intelligence predicting or monitoring long-term complications after regenerative surgery?
There is a lot of talks about artificial intelligence. I think is a very powerful tool to analyze, to gather many parameters.
Yes.
So from this
the
side,
big amount of data.
Exactly, is management of data.
Yeah.
But then I believe that human intelligence has to take over and take the key decisions with the help of artificial intelligence. But still, remind that your brain is the one taking the
final decisions.
Yes,
absolutely. Professor, thank you so much, and
My
enjoy
pleasure.
the rest of the Congress.
Thank you so much.
Thank you so much.
Thank you so much.